Renal failure, another name for kidney failure, is a disorder that millions of individuals experience globally. Although the kidneys are sometimes disregarded in health talks, they carry out essential tasks that maintain our bodies functioning properly. We will delve further into kidney failure in today's video, covering its warning signs, symptoms, underlying causes, and possible treatments. Keep checking back as we take you through all the medical and scientific information you require regarding this potentially fatal illness.
Introduction to the kidneys and their role in the body. Let's start by summarizing the functions of the kidneys. Every individual has two kidneys, which are situated beneath the rib cage on either side of the spine. These tiny bean-shaped organs perform a number of vital tasks, including filtering waste from blood, preserving fluid balance, controlling electrolytes, and generating critical hormones like erythropoietin, which promotes the creation of red blood cells. Nephrons, which are millions of microscopic filtering units, are found inside the kidneys. Toxins, extra water, and salts are eliminated by these nephrons, preserving homeostasis, a steady internal environment in the body. However, these functions are substantially compromised when renal failure sets in, with potentially catastrophic health effects. Types of kidney failure. There are two primary types of kidney failure: acute kidney failure and chronic kidney failure. Both offer distinct difficulties, yet they differ greatly in their beginning, development, and causes. Acute kidney failure, also known as acute kidney injury (AKI), typically appears in a matter of hours or days. Sudden events such as trauma, acute illness, sepsis, dehydration, or exposure to toxins like poisons or certain drugs are frequently the cause of it. By lowering blood supply to the kidneys, diseases including heart failure and severe burns can also result in AKI. AKI needs to be treated right away since it is a medical emergency. Thankfully, it is frequently reversible and renal function may be totally recovered if treatment is received early. Chronic kidney failure. Conversely, chronic kidney disease (DECT), often known as chronic kidney failure, advances gradually over months or even years. It frequently results from long-term illnesses that progressively harm the kidneys, such as diabetes, hypertension, or chronic glomerulonephritis. The kidneys lose their capacity to operate effectively in chronic kidney failure, and the damage is typically irreversible. Based on the glomerular filtration rate (FRA), a measurement of how well your kidneys is filtering waste, chronic kidney disease (GAGD) is usually divided into 5 stages. End-stage renal disease (ESRD), often known as stage 5, denotes total kidney failure. Signs and symptoms of kidney failure. Early kidney failure detection is essential for prompt treatment and improved health outcomes. However, because symptoms may not show up until the kidneys are seriously damaged, kidney disease is frequently referred to as a silent killer. The signs and symptoms of kidney failure may vary based on whether the condition is acute or chronic. But let's discuss the most common symptoms to watch out for.
Early symptoms of kidney failure. Early symptoms of kidney failure may include
fatigue and weakness. As waste products accumulate in the blood, patients often feel tired and lethargic. Changes in urination. The kidney's inability to filter waste properly may lead to increased or decreased urination, as well as dark or foamy urine. Swelling edema. When the kidneys fail to remove excess fluids, swelling may occur in the legs, ankles, feet, or face. Shortness of breath. Fluid buildup in the lungs can make breathing difficult, especially during physical activity. Itchy skin and dryness. A buildup of toxins in the bloodstream can cause persistent itching and dry skin. Severe symptoms and complications. As kidney failure progresses, symptoms can become more severe, including nausea and vomiting. The body's buildup of waste products can cause gastrointestinal distress. Loss of appetite. Patients may experience an aversion to food, leading to weight loss and malnutrition. Muscle cramps and weakness. An imbalance of electrolytes like potassium and calcium can cause painful cramps and muscle weakness. Cognitive impairment. The accumulation of waste in the bloodstream can affect brain function, leading to confusion, difficulty concentrating, and even seizures in severe cases. Severe hypertension. As kidney function worsens, high blood pressure may become difficult to control, further exacerbating the condition. Diagnosis of kidney failure. Diagnosing kidney failure involves a comprehensive assessment of medical history, clinical examination, and a series of diagnostic tests. Blood and urine tests. The two main blood tests used to assess kidney function are blood urine nitrogen bun and serum creatinine. Increased concentrations of these waste products signify a malfunctioning kidney, Tests for kidney impairment, such as the albumin to creatinine ratio ACR, can detect protein leakage in urine. Imaging tests, imaging procedures like CT scans or ultrasounds, let medical professionals see into the kidneys and identify any anomalies like tumors, cysts, or blockages. These imaging tests can offer insightful information about the kidney's structural integrity. Kidney biopsy. In certain situations, a kidney biopsy might be necessary. During this process, a tiny sample of kidney tissue is taken for microscopic examination. Important details regarding the origin and degree of the injury can be found through a biopsy. Causes and risk factors of kidney failure. Several factors can lead to kidney failure. Understanding these risk factors can help with prevention and early detection. Common causes of acute kidney failure. Acute kidney failure is often caused by sudden disruptions to kidney function. Common causes include reduced blood flow. Conditions like severe dehydration, shock, or heart failure can limit blood flow to the kidneys. Direct damage to the kidneys. Infections, toxins, certain medications, and autoimmune diseases like lupus can directly damage kidney tissue. Urinary obstruction. Kidney failure can result from blockages that prevent urine from draining, such as kidney stones, tumors, or an enlarged prostate. Causes and risk factors for chronic kidney failure. Chronic kidney failure is most commonly associated with long-term conditions. The leading causes include diabetes. Over time, high blood sugar levels harm the kidney's tiny blood vessels, making it more difficult for them to properly filter blood. Hypertension. Uncontrolled high blood pressure can damage the blood vessels in the kidneys, reducing their filtering capacity. Chronic glomerulonephritis. Inflammation of the kidney's filtering units can lead to permanent damage. Polycystic kidney disease, a genetic disorder that causes fluid-filled cysts to grow in the kidneys, eventually leading to kidney failure. Family history. Having a close family member with kidney disease increases the risk of developing the condition. Treatment options for kidney failure. Once diagnosed, the treatment for kidney failure depends on the severity of the condition, the underlying cause, and whether the failure is acute or chronic. Treatment for acute kidney failure. In acute kidney failure, the goal is to treat the underlying cause and support the kidneys as they recover. This may involve intravenous fluids. Restoring proper hydration and electrolyte balance can help the kidneys regain function. Medications. Doctors may prescribe medications to manage blood pressure, treat infections, or prevent further kidney damage. Dialysis. Temporary. In severe cases, dialysis may be required temporarily to filter the blood while the kidneys recover. Treatment for chronic kidney failure. For chronic kidney failure, treatment focuses on slowing the progression of the disease, managing symptoms, and preventing complications. Medications. Medications to control blood pressure, manage diabetes, and reduce cholesterol levels are often prescribed. Dietary changes. Patients are recommended to eat a diet low in salt, potassium, and phosphorus in order to support their kidneys. Keeping oneself properly hydrated is also crucial. Dialysis. Long-term. Dialysis becomes a long-term solution in end-stage renal illness. The two primary forms of dialysis, hemodialysis and peritoneal dialysis, are intended to filter blood when the kidneys are unable to do so. Kidney transplant. The most effective way to return kidney function to normal in certain patients may be through a kidney transplant, but this process needs a good donor. And there are a lot of risks and difficulties associated with immunosuppressive drugs and the possibility of rejection. Preventing kidney failure. While kidney failure can be life-altering, there are steps you can take to reduce your risk and maintain kidney health. Monitoring and managing health. Key preventive measures include regular health checkups. Monitoring blood pressure, blood sugar, and kidney function regularly can catch early signs of kidney disease. Controlling diabetes and hypertension. Keeping diabetes and hypertension under control can significantly reduce the risk of kidney damage. Healthy diet and lifestyle. Following a balanced diet, avoiding excess salt and processed foods, staying hydrated, and exercising regularly all contribute to overall kidney health. Avoiding harmful substances. In summary, kidney failure is a serious condition, but patients can live happy lives with correct management and early intervention. Other ways to preserve the kidneys include limiting the use of non-steroidal anti-inflammatory medicines (NSAIDs), abstaining from smoking, and decreasing alcohol use. Being aware of the warning signals, symptoms, and available treatments enables people to take charge of their kidney health and seek prompt medical attention.
I appreciate your viewing. We hope that this thorough summary has given you important new knowledge on renal failure.
Appreciate you seeing the video for today. We hope this information was helpful to you. If so, kindly like, comment, and subscribe to our channel in order to receive more advice and insights about health. Please leave a comment below if you have any queries or suggestions for topics we should
Subscribe to my channel.